Do you suffer from hip pain on the outside of your hip and you touch that bone right here called the greater trochanter and it really hurts? Well, you might be suffering from a hip bursitis. So what I would like you to do is I'd like you to try doing these 3 exercises at home and see how you do and see if you get better over the next couple of weeks. Sometimes the hip bursitis is due to the crossing of the fibers of the gluteus medius and the gluteus minimus. So let me show you how to stretch those two muscles. To stretch the gluteus minimus, we will do the left side for the camera. Always do both sides. You're going to sit in the 90-90 position like this. Thigh straight out in front of me, knee at 90, back thigh out from me, knee at 90. You're going to prop yourself up as tall as you possibly can. Chin is in, eyes are down. You're trying to give yourself an arch in your low back. Now, I'm going to lead with my belly button and I'm going to go forward. I'm trying to dump water out the front of my pelvis, and right there, I start getting a really nasty pull back in my left butt cheek. I'm telling you right now, if you're doing this, you are doing nothing because you're just stretching your low back. If I turn sideways for the camera, you will see that I propped myself up and I'm leading with my belly button and I'm going forward. Right there is all I need. Sometimes I'll tell people to take their opposite hand, grab a hunk of their glute, or their butt. So I'm grabbing my left butt cheek and I'm pulling it out from underneath me as I go forward. And now I'm getting a really good pull. If you want to add the fascia of the lat into it, spread the fingers, pull the wrist back, push your palm forward, and now hold and breathe for 30 seconds. Slowly relax and switch sides. Do that 3 times on each side for the gluteus minimus. Now, to do the gluteus medius, again, left side for the camera. Fix the right leg, turn the kneecap in, pull the big toe toward the nose. Bring the left leg across your body. Now, it's mandatory that my left sit bone stays on the ground. I want you to hook the outside of your knee with your right arm, and now pushing the left sit bone down to the ground, I want you to pull that left knee across your body, and I'm getting a real nasty pull right here on the outside of my hip. If you want to hug that thigh like that, that's fine. If you want to add the fascia of the latissimus dorsi in by going like that, that's fine. But you're going to hold and breathe for 30 seconds. Again, erecting the spine as tall as you can, pushing that left sit bone down to the ground, and pulling that left knee across your body. Hold and breathe for 30 seconds. Slowly relax. And again, switch to the right side and do those 3 times on each side. Now, the last technique that I'd like you to do if you're suffering from pain on the outside of that hip is a really simple self-pumping technique where you're going to be lying on your side. You're going to find that greater trochanter, okay? And it's going to be tender. And all I simply want you to do is put your index finger on the bone and put your middle finger on top of the index finger. I want you to push your index finger into the bone, push your middle finger on top of the index finger, let go of the index finger, let go of the ring finger. So index finger, ring finger, let go of the index finger, let go of the ring finger. Index finger, ring finger, let go of the middle finger, let go of the index finger. I said it wrong that time. Another thing that you could do is you could put the index finger on that bone, put the middle finger over the index finger, press the index finger into the bone, press the middle finger on top of the index finger, let go of the middle finger, let go of the index finger. So again, index finger, middle finger, let go of the middle finger, let go of the index finger. I kind of like that move better for you at home. Index finger, middle finger, let go of the middle finger, let go of the index finger. And that would be like a self-pumping technique that you can do to yourself at home. You know you are on the right path if you start pumping that, and after about 15, 20, 25, 30 pumps, it starts to feel better. Then what you're doing is you're actually pumping the fluid back into that bursa again. So find that spot in your outside hip that hurts and do some self-pumping. Again, index finger pushes, middle finger pushes on top of the index finger, let go of the middle finger, let go of the index finger. Do that over and over, 30, 40, 50 times, and see if that helps your outside hip pain.